Module number 12, Pressure and Manipulation, Reflexology, Massage, and Acupressure. Touch. The simple touch of one person to another can have a therapeutic effect. Massage therapy is the practice of manipulating the muscles and connective tissue of the body to reduce tension, enhance blood flow, activate the relaxation response, and promote healing. Massage therapists typically apply pressure to the soft tissue of the body by rubbing the muscles with their hands and fingertips. There are more than 80 different styles of massage therapy, most of which involve the use of a massage table or a specially designed mat or chair. Gentle forms, such as Swedish massage, use kneading and gliding strokes to relax the top muscular layer. A lot of scientific research on massage therapy is preliminary or conflicting, but much of the evidence points towards beneficial effects on pain and other symptoms associated with a number of different conditions. Much of the evidence suggests that these effects are short-term and that people need to keep getting massages for the benefits to continue. Researchers have studied the effects of massage for many conditions. Some that they have studied more extensively are the following: pain, cancer, mental health, fibromyalgia, headaches, HIV/AIDS, infant care, and other conditions. In the United States, 44 states and the District of Columbia regulate massage therapists. Cities, counties, or other local governments also may regulate massage. Training standards and requirements for massage therapists vary greatly by state and locality. Do not use massage therapy to replace conventional care or to postpone seeing a healthcare provider about a medical problem. If you have a medical condition and are unsure whether massage therapy would be appropriate, discuss your concerns with your healthcare provider, who may also be able to help you select a massage therapist. Ask about the training, experience, and credentials of the massage therapist you are seeking. Also, ask about the number of treatments that might be needed, the cost, and insurance coverage. Tell all your healthcare providers about any complementary or integrative health approaches you use. Give them the full picture of what you do to manage your health. This will ensure and coordinate safe care. A licensed massage therapist should be consulted and can help you decide which massage would be most beneficial for you. Swedish massage is the most often offered in wellness centers. It's based on concepts of anatomy and physiology, compared to other forms of massage that are energy-centered. Swedish massage. The standard type of massage offered in most clinics, gyms, spas, and wellness centers, Swedish massage is virtually synonymous with massage therapy. It is based on the Western concept of anatomy and physiology, compared to the energy-centric style more common in Asian forms of massage. Using lotion or oil, massage therapists typically begin with a broad general strokes and then transition to specific strokes to address problem areas. There are 5 basic strokes in Swedish massage therapy: effleurage, long smooth strokes; pétrissage, kneading, rolling, and lifting; friction, ringing or small circular movements; tappement, percussion; and vibration, rocking or shaking movements. Swedish massage provides full body muscle relaxation, and it can be especially helpful if you're recovering from an injury. Oil massage. An aromatherapy massage is a Swedish massage with scented plant oils, known as essential oils, added to the oil. Extracted from flowers and other plants, essential oils offer a pleasing scent and are believed to have healing properties. Lavender and rose, for instance, are known to promote relaxation. Although oils may be selected to address specific needs, the therapist typically uses pre-blended oils to relax, energize, or uplift. The soothing effects of aromatherapy massage can be a benefit for a variety of conditions, including headaches, insomnia, certain digestive disorders, back pain, and even premenstrual symptoms. The Before receiving an aromatherapy massage, make sure you're not allergic to any of the plants used in the oils, since that may cause a reaction on the skin. Hot stone massage. As the name implies, hot stone massage uses warm stones. The therapist places heated, smooth stones on specific points of the body and also holds the warm stones while giving the massage. The stones are usually basalt, a volcanic rock that retains heat well. The warmth of the stones can be relaxing and can loosen tight muscles so that the therapist can reach areas of muscle tension quickly. If you have certain medical conditions, such as high blood pressure, diabetes, heart disease, or varicose veins, you should check with your healthcare provider if you plan on getting a hot stone massage. Likewise, if you take any blood thinning medication, be sure to get a medical opinion first. Deep tissue massage. This is focused, therapeutic massage that targets muscle knots and specific problem areas in the deep layers of muscle and connective tissue. Using deliberate slow strokes or friction across the grain of the muscle, the therapist addresses chronic, tight, or painful muscles, repetitive strain, postural problems, or injuries. While it's true that the pressure of deep tissue is generally more intense than that of a Swedish massage, it shouldn't have to be painful to be effective. If you're experiencing pain, let your therapist know right away. This type of massage is particularly beneficial for people with chronic pain or lingering injuries that cause limited mobility. It's effective in treating repetitive stress injuries, such as tennis elbow or carpal tunnel syndrome, and can be helpful in reducing the symptoms of osteoarthritis. Shiatsu massage is a form of Japanese bodywork that involves localized pressure using the therapist's fingers or sometimes hands and elbows, applied in a rhythmic sequence along the body. Each point is held for about 2 to 8 seconds. The goal of shiatsu is to stimulate acupressure points on the body to improve the flow of energy and help maintain balance. Since no oil or lotion is used, you wear loose clothing. Shiatsu is normally done on a mat on the floor or in a low massage table and is often used to reduce stress and protect against stress-related health issues. It's also believed effective for treating conditions like arthritis, insomnia, back and neck pain, sciatica, and even sinus problems. Shiatsu may help increase energy, promote recovery from injuries, and stimulate the digestive system. Thai massage. A unique blend of assisted yoga, passive stretching, and pressing massage movements. Thai massage is more energizing than other forms of massage. It's a little bit like yoga without doing the work, as the therapist moves and stretches you in a sequence of postures, usually on a mat on the floor. Like shiatsu, Thai massage aligns the energies of the body. The massage therapist uses rhythmic compression along the body's energy lines to reduce stress and improve flexibility and range of motion. It is done fully clothed. This type of massage can reduce muscle spasticity and back pain, and is shown to be useful in treating balance problems and migraine symptoms. Pregnancy or prenatal massage is customized to an expectant mother's needs, but is most often used to promote relaxation. Since many women who are pregnant suffer from lower back pain and swollen ankles, especially in the later months, prenatal massage is a relatively safe and drug-free way to provide relief. Massage therapists who have received specialized training and are certified in prenatal massage know how to position and support the woman's body during the massage, modify techniques, and avoid certain areas and techniques during pregnancy. Most will have a special table that allows the woman to rest comfortably and safely during the massage. Ideally, you should seek out a practitioner who is experienced and licensed in prenatal. Reflexology. Do you like having your feet worked on? The therapist uses finger pressure and techniques such as kneading and rubbing to promote relaxation and healing in the body. Reflexology is based on reflex areas on the hands and feet whose energy is believed to be connected to organs and other body parts. applying pressure to these reflex points, the reflexologist can balance your nervous system and stimulate endorphins, the body's natural pleasure response, which reduces stress and discomfort. Reflexology dates back to ancient civilization, but was refined by American physiotherapist Louise Ingram in the 1930s. This can be a deeply relaxing therapy, especially if you stand all day or have tired, achy feet. You remove your shoes and socks, but otherwise remain clothed. Sports massage. Designed to prevent and treat injuries, improve flexibility, and enhance athletic performance, sports massage can be used by athletes of all abilities to prepare for or recover from athletic or sports injuries. Even if you aren't an athlete, sports massage may help muscle pain or restricted range of motion. The idea behind sports massage is to manipulate the body's soft tissues and focus on certain muscle groups depending on which sport the athlete plays. This type of massage can help with increased blood flow, increased range of motion, and increased flexibility. In sports massage, the strokes are generally faster than a typical Swedish massage. The therapist may also include compression, pressure point therapy, friction, and joint mobilization. When you're looking for massage therapy, be sure to check which type of massage a practitioner can provide. Match that with the benefits you hope to get from your session. Choosing a therapist is as important as choosing a doctor, hairstylist, because technique and ability vary. You may want to chat with several different practitioners to find the one who understands your needs and is used to working with people with similar goals. Be sure also to discuss any allergies, such as scents or plant oils, so your massage will be relaxing and beneficial without that concern. Reflexology. Reflexology is the application of pressure to areas on the feet, hands, and ears. It is generally relaxing and may be an effective way to alleviate stress. The purpose is to attempt to restore its normal, healthy physiology. It's an ancient technique based on the premise that there are reflex points on the feet and hands that correspond to every muscle, nerve, organ, gland, and bone in the body. It is believed that pressing on these points can break up congestion, and this helps the nerves relax and return to normal. Reflexologists use foot charts to guide them as they apply pressure to specific areas. Sometimes these practitioners use items, such as rubber balls, rubber bands, and sticks of wood to assist in their work. Practitioners of reflexology include chiropractors, physical therapists, and massage therapists and others. The basic concept behind reflexology is that since there are 10 fingers and 10 toes, the body can be divided into at least 10 zones. These zones run from toe to head, and then each of the fingers is also connected to a zone. What is of scientific interest is the fact that there actually are single nerve cells which run from feet to head, and a total of about 7,200 nerves in each foot is having some biological collaboration with this method. Several studies funded by the National Cancer Institute and the National Institute of Health indicate that reflexology may reduce pain and psychological symptoms such as anxiety and depression, and enhance relaxation and sleep. Studies also show that reflexology may have benefits in palliative care of people with cancer. Reflexologists claim that it can treat a wide variety of medical conditions, including asthma, diabetes, and cancer. However, scientific evidence is lacking to support these claims. Reflexology is generally considered safe, although very vigorous pressure may cause discomfort for some people. Acupressure is a therapy developed over 5,000 years ago as an important aspect of Asian, especially Chinese medicine. It uses precise finger placement and pressure over specific points along the body. These points follow specific channels known as meridians, the same channels used in acupuncture. According to Asian medical philosophy, activation of these points with pressure or needles can improve blood flow, reduce tension, and enhance or unblock life energy known in China as qi. This release allows energy to flow more freely through the meridians, promoting relaxation and restoration of proper function. It should be noted that the existence of qi and meridian is doubted by many Western scientists. According to this skeptical view, any healing effect from acupuncture or acupressure sessions is not due to the alteration of subtle energy flows along invisible channels, but rather to the same gross physical effects that happen during any kind of massage therapy, including muscular relaxation and improved regional blood flow. What conditions is acupressure used for? It can be used to relieve pain, reduce tension in muscles, improve circulation, and promote deep states of relaxation. It's often done by massage therapists and other body workers, but can also be learned as a technique to be done by itself. Individuals can be treated, then trained to various self-care applications and pressure point formulas for specific conditions. These include nausea and vomiting, motion sickness, headaches, neck and back pain, as well as chronic fatigue, fibromyalgia, mental and emotional stress, and even addiction recovery and learning disorders. For centuries, the Chinese have used acupressure points as a beauty treatment to enhance muscle tone and increase circulation, especially facial muscles. This can reportedly improve the condition and appearance of the skin, lessening wrinkles and sagging of the face without drugs or surgery, although clinical trials are needed to confirm this. Acupressure points have also been employed to increase arousal, decrease sexual tension, and reportedly aid in alleviating sexual dysfunction, including infertility, decreased sexual desire, premature ejaculation, and impotency. What should one expect on a visit to a practitioner? An acupressure session is typically performed with the patient lying on a massage table, or it can be used in conjunction with exercises such as Tai Chi or Qigong. As stated, one can also learn acupressure as a self-care strategy, utilizing the techniques anytime it is desired. Typical sessions with a practitioner might last 45 to 90 minutes and are often done in conjunction with some form of massage therapy. This means that the same acupressure points may be manipulated with various rhythms and pressure, using the fingers, hands, arms, elbows, and even legs and feet. The recipient should wear comfortable, loose-fitting clothing, such as that typically worn during exercising or doing yoga. Slow, full, deep breathing is often encouraged, especially with pressure applied to points that cause discomfort or that the practitioner regards as having blocked energy. Guided imagery or visualization is often added to allow further relaxation of movement of energy to and through pressure points. Following treatment, the practitioner may ask for feedback and offer home exercises or self-care, because energy work of any kind can cause profound relaxation. Care should always be used when rising from the table and returning to a standing posture, as the legs and trunk muscles may feel weak. Are there any situations where acupressure should be avoided? Acupressure should not be considered primary treatment for serious illness and should be used with care during pregnancy, as certain points are thought to stimulate uterine contractions. Pressure should not be exerted over areas with burns, infection, contagious diseases of the skin, or active cancer. Is there a growing body that oversees or credentials acupressure practitioners? There is not a governing agency that credentials practitioners. However, some states require them to obtain a license in another area of healthcare, such as massage therapy, nursing, or acupuncture, before they can practice hands-on techniques. Many massage therapy schools offer a certificate of achievement in acupressure after completing a minimum of 150 hours of coursework. How does one get in touch with a practitioner of acupressure? In order to find a practitioner, any search engine such as Google can be a starting point. Be sure to check the practitioner's credentials. Word of mouth is always a good way to gauge the experience of others. Oftentimes, individuals who use acupressure will also be skilled in various other forms of body work. Are there other therapies that might work well in conjunction with acupressure? Many therapies work well with acupressure. In various forms, it can be used as an effective adjunct to other kind of manipulative therapy. Massage therapists often incorporate acupressure into their massage routines. By relaxing and toning muscles prior to adjustment, acupressure can make manipulation easier and more effective, allowing longer time between return visits. A good chiropractor or osteopath will often have a massage therapist doing these treatments prior to seeing them. Martial arts exercises such as Tai Chi or Qigong may use acupressure points in their routines. Mind, body, and breathing techniques are an integral part of achieving positive outcomes with acupressure. Acupressure is considered safe and simple to use on your own. Many people choose to use it to support natural healing and stress management. It can be helpful when used in conjunction with the doctor's instructions, but never in place of it. Put pressure on these points. Mayo Clinic cites examples where their patients successfully use it at home to support prescribed therapy. Use deep, firm pressure to massage and stimulate each point. When massaging acupoints, try to relax in a comfortable position, close your eyes, and breathe deeply. Repeat the massage as often as you like. There is no limit to the number of times per day. Besides massaging these points on yourself, anyone can also help massage these points further. Acupuncture. Acupuncture involves the insertion of very thin needles through your skin at strategic points on your body. A key component of traditional Chinese medicine, acupuncture is most commonly used to treat pain. Increasingly is being used for overall wellness and stress management. Traditional Chinese medicine explains acupuncture as a technique for balancing the flow of energy or life force known as qi, believed to flow through pathways or meridians in the body. By inserting needles into specific points along these meridians, acupuncture practitioners believe that your energy flow will rebalance. In contrast, many Western practitioners view the acupuncture points as places to stimulate nerves, muscles, and connective tissue. Some believe this stimulation boosts your body's natural painkillers. Why it's done. Acupuncture is used mainly to relieve discomfort associated with a variety of diseases, including chemotherapy-induced and post-operative nausea and vomiting, dental pain, headaches, including tension headaches or migraines, labor pain, low back pain, neck pain, osteoarthritis, menstrual cramps, and respiratory disorders, such as allergic rhinitis. The risks of acupuncture are low if you have a competent, certified acupuncture practitioner using sterile needles. Common side effects can include soreness and minor bleeding or bruising where the needles were inserted. Single-use, disposable needles are now the practice standard, so the risk of infection is minimal. Not everyone is a good candidate for acupuncture. You may be at risk for complications if you have a bleeding disorder. Your chances of bleeding or bruising from the needles increase if you have a bleeding disorder, or if you're taking blood thinners. If you have a pacemaker, acupuncture that involves applying mild electrical pulses to the needles may interfere with the pacemaker's operation. Or if you're pregnant, some types of acupuncture are thought to stimulate labor, which could result in a premature delivery. No special preparation is required before acupuncture treatment. Choosing a practitioner. If you're considering acupuncture, take the same steps you would to choose a doctor. Ask people you trust for recommendations. Check their training and credentials. Most states require that non-physician acupuncturists pass an exam conducted by the National Certification Commission for Acupuncture and Oriental Medicine. Interview the practitioner. Ask what's involved in the treatment, how likely it is to help the condition you have, and how much it will cost, and find out whether your insurance covers the treatment. Tell your doctor you're considering acupuncture. He or she may be able to tell you about the success rate of using acupuncture for your condition or recommend a practitioner. What to expect. Each person who performs acupuncture has a unique style, often blending aspects of Eastern and Western approaches to medicine. To determine the type of acupuncture treatment that will help you most, your practitioner may ask you about your symptoms, behaviors, and lifestyle. He or she may closely examine the parts of your body that are painful, the shape, coating, and color of your tongue, the color of your face, the strength, rhythm, and quality of the pulse in your wrist. This initial evaluation and treatment may take up to 60 minutes. Subsequent appointments usually take about a half hour. A common treatment plan for a single complaint will typically involve 1 to 2 treatments per week. The number of treatments will depend on the condition being treated and its severity. In general, it's common to receive 6 to 8 treatments. During the procedure, acupuncture points are stimulated in all areas of the body. Sometimes the appropriate points are far removed from the area of your pain. Your practitioner will tell you the general site of the planned treatment and whether you need to remove any clothing. A gown, towel, or sheet will be provided. You lie on a padded table for the treatment, which involves needle insertion. The acupuncture needles are inserted to various depths at strategic points on your body. Acupuncture needles are inserted to various depths at strategic points on your body. The needles are very thin, so insertion usually causes little discomfort. People often don't feel them inserted at all. Between 5 and 20 needles are used in a typical treatment. You may feel a mild aching sensation when the needle reaches the correct depth. Needle manipulation. Practitioner may gently move or twirl the needles after placement, or apply heat or mild electrical impulses. Needle removal. In most cases, the needles remain in place for 10 to 20 minutes while you lie still and relax. There is usually no discomfort when they are removed. After the procedure, some people feel relaxed and others feel energized, but not everyone responds to acupuncture. If your symptoms don't begin to improve within a few weeks, it may not be right for you. Results. The benefits of acupuncture is sometimes difficult to measure, but many people find it helpful as a means to control a variety of painful conditions. Several studies, however, indicate that some types of simulated acupuncture appear to work just as well as real acupuncture. There's also evidence that it works best in people who expect it to work. Acupuncture has few side effects, so it may be worth a try if you're having trouble controlling pain with more conventional methods.